The Gastroenterology station. Today we're going to talk about everything to do with the abdomen. So stay tuned for some tips, tricks, and how to pass first time. Peace and blessings, YouTube family. Today we're going to talk about the abdominal examination, or the gastro station. This is a station that can throw people a little awry sometimes because of the breadth of pathologies that you can get. But in essence, it's quite simple. So we'll talk today about an easy breakdown of this station, some of the things that might come up, the investigations and management. So step one is always start off with wiper. Wash your hands. Introduce yourself to the patient and inspect your surroundings. Ask the patient if they are in any pain and ask them for permission to conduct the examination. Expose the child to whatever degree is needed for the examination. Reposition the child at a 45-degree angle. Step two is looking for dysmorphic features. Some of the dysmorphic syndromes that you may get in the abdominal station are Alagille syndrome, also mucopolysaccharidoses. Next, check the hands for any clubbing in the nails, indicative of chronic disease. Also, you can ask them to elicit the liver flap. So again, that is where you ask the child to push their arms up to 90 degrees and push their wrists back. Keep their eyes closed. And what you may notice is a flap. That's known as asterixis or liver flap. You should also look for palmar erythema, again indicative of liver failure. And finally, Shamroth's sign, again to elicit clubbing. The way I ask children to demonstrate the Shamroth sign is as follows. Fingers up, fingers down, fingers together. And most children can follow that, and you can really look at the angle of the nail bed to see whether there is any evidence of clubbing. Next, you inspect the eyes, and in the eyes you're looking for evidence of conjunctival pallor, scleral jaundice, and any obvious Kaiser-Fleischer rings, indicative of copper buildup, typically in Wilson's disease. Next, you inspect the mouth, looking for any mouth ulcers, any gum hypertrophy, typically associated with ALL, any perioral pigmentation, associated with Peutz-Jeghers syndrome, any mucosal candidiasis, associated with a multitude of cancers, and any glossitis or angular stomatitis, indicative of vitamin B12 deficiency. Next, you can ask the child to remove their top, and then you examine their lymph nodes, typically in the axillary region and also the supraclavicular region. If you do happen to find an enlarged lymph node, do remember its location, its size, so the diameter, and also whether it felt regular and soft or irregular and hard. You should also examine and inspect for any gynecomastia or any spider nevi, both indicative of liver disease. Now on to the main part of the examination, the abdomen. You should inspect the abdomen at a completely flat surface. So ask the child if they have any difficulty, if the bed would be lowered all the way down, and then inspect the abdomen. Ask them to suck in their tummy as much as they can and blow their tummy out as much as possible. What you're looking for here is a fixed abdominal mass which does not change its size when the child is doing these movements. Next, you should also inspect for any central catheters, any scars on the site. Next, you should palpate, and you should do a superficial palpation of all 9 segments of the abdomen, moving on to deep palpation of all segments, and at all times your eyes should be on the child, not on the abdomen, so that you can see instantly if there is any pain. That is one thing the examiners will look for. Next, you should palpate the bottom edge of the liver, the bottom edge of the spleen, and also feel for the kidneys, whether they are ballottable on each side. Moving on to percussion. Same as with palpation, you should start your percussion in the right iliac fossa. Moving up to where the percussion becomes more dull, that is indicative of edge of the liver on the right, the edge of the spleen on the left, and the edge of the bladder inferiorly. Finally, you should auscultate at the right iliac fossa for bowel sounds, and you may also listen to the kidneys at the back, listening for any bruise. Finally, you should palpate for any sacral edema and pedal edema. And that is the examination complete. You thank the child and their relative, turn to the examiner and say, to complete your examination, I would like to plot this child's height and weight on an appropriate growth chart, take a mid-arm circumference for nutritional status, examine the hernial orifices, the genitalia and anus if felt appropriate, with a chaperone. The cases that can be presented to you in this station are hepatomegaly, splenomegaly, hepatosplenomegaly, gross ascites, and umbilical hernias, all of which I have covered in my free guide to the MRCPCH clinical exam, so please check that out in the description below. The examiner will then ask you 2 questions. How will you investigate this child? Investigations are always divided into 4 categories: bedside, blood tests, imaging, and other investigations. Bedside tests include height and weight, and plotting that on the appropriate growth chart, and a mid-arm circumference for nutritional status. Blood tests include urea and electrolytes, liver function tests, amylase, thyroid function tests, B12, vitamins and iron studies, and anti-TTG to look at a celiac screen. Imaging mainly will consist of an ultrasound of the abdomen, plus or minus an MR enterogram. The examiner will then ask you what management you would do of this child. Management is always divided into 4 categories: acute, chronic, with a multidisciplinary team approach, school and social, and family management. Acute management is an A to E approach of the child, ensuring that the child has any TPN that they may need and that their nutritional status is healthy. Chronic management includes the multidisciplinary team, which includes the pediatric gastroenterologist, pediatric surgeons, the local pediatrician, arranging open access to the pediatric ward as a bonus point, the dietitian, speech and language therapy, and potentially the need for a geneticist. Open access is a scheme used within the United Kingdom to allow children with chronic problems quick and easy access to the paediatric team for advice, examination, and management. School and social management, every child will benefit from an educational healthcare plan and a social worker to undertake a financial needs assessment of the family to ensure that their financial needs are met. And if the child can benefit from any extra support, then this would be provided for them. Finally, family management consists of giving a leaflet to the parents with regards to the condition of the child, telling them some of the red flag symptoms that they may encounter, in which case they need to bring the child to the hospital, and also giving them some information about family support groups. The one that I prefer is contactafamily.org because it's online and it connects families with children with similar problems, and it is completely user-led and user-referred. So that is how to pass your abdominal examination station. Please like, comment, share and subscribe for more videos. This has been The Baby Doctor. Peace and blessings.